There are many examples of how applying a gender lens has helped us at Dalberg to deliver better health outcomes. Recently, we partnered with a private foundation on the question of how could the foundation better deploy its grant investments in order to strengthen the pharmaceutical sector in several countries in Africa, specifically around the delivery of emergency medicines. Now, there was nothing in the original terms of reference from the foundation that required us to apply a gender lens. But because Dalberg is committed to doing so across all of our work, that's what we did. And what we found was that there were significant differences, both in terms of what men and women pharmacists needed in order to upskill, but also that those differences took place differently at different points in the life cycle of their professional careers. So we found that men and women were graduating with pharmaceutical degrees in roughly the same ratio. Then men would be likely to go into manufacturing and women much more likely to go into public sector regulatory. And so we were then able to address the insufficient supply on the manufacturing side by designing targeted programs to support women in entering manufacturing and industry careers. And then at later inflection points, to support men and women differentially in the upskilling that they needed, some of which was shared, some of which was tailored and different. It was in that way that ultimately a gender lens enabled us not just to address the needs of women pharmacists, but in fact, better outcomes for both men and women and a stronger pharmaceutical sector for the country.